I want to briefly begin by thanking Professors Harner, Hansen, and Gifford, as well as Dr. Faden, for taking times out of their very busy schedules to make this event happen. About 18 months ago, I came knocking on their doors with an idea for an event focused on the NFL concussion litigation. As I thought, who wouldn't be interested in that? It's the law and it's football, more importantly. Well, since then, with their generous time and their help, that idea grew into this symposium today, magnificently hosted by the Journal of Business and Technology. The topics for the next panel are returning to play, baseline assessments, and cost management. These topics are particularly important because there's usually no clear biological marker or test to accurately diagnose a sports-related concussion. I know that well from the 3 concussions I suffered playing ice hockey, with the last the scariest. I'd hit the back of my head on the ice after getting blown up coming around the net. I slowly began to lose my vision over 4 or 5 minutes. It was like a TV slowly losing reception, but with big, colorful blotches blocking my vision. At one point, I even remember I turned to my friend Sam at the face-off about 2 to 3 feet away from me, and I said, "Sam, I can't see your face right now." Unlike many schools, mine was lucky enough to have a trainer actually on site to administer the little concussion test between the periods. We all know them, follow my finger, stand on one foot, who's the president. But even the athletic trainer, not my old coach who grew up going to school both ways uphill in the snow, even she didn't recognize that concussion, so I was allowed to return to the ice for one more shift before I pulled myself from the game. But not properly taking care of concussion symptoms is often less extreme than that. After my second concussion, my parents were out of town, so I was staying with my grandparents. The first thing we did after my hockey game was to go get a McDonald's quarter pounder, and then I went to sleep. Obviously, they didn't know that doctors recommend right after concussions, 1, not to eat, and 2, not to sleep. But don't worry, I did go to the hospital a few hours later once my parents heard I'd been knocked out. Unfortunately, as we know, my grandparents aren't the only ones, though, who don't know how to react to an athlete showing signs of a concussion. Thankfully, the next panel will discuss athletes returning to play and how we can implement better policies to detect symptoms and prevent subsequent concussions. Relatedly, the panel will also cover the use of baseline assessments, as was mentioned earlier today. Baseline assessments help identify concussions because the first test is administered at the beginning of the season when the athlete is concussion-free and operating at his or her baseline. Thus, when the test is administered again after concussion symptoms appear, the easily comparable results can indicate a concussion that more traditional tests might not pick up on. Schools are just beginning to implement baseline tests, but hopefully our panelists can elaborate on their utility and implementation for more widespread use. Finally, since schools in all regions and at all levels have cited costs as a primary obstacle to improving safety procedures in sports, our panelists will address current state statutes and policy and how we can create more efficient and affordable concussion management programs. Our moderator for this panel is Mr. Patrick Ruby. Mr. Ruby is a Georgetown graduate with a master's from Northwestern University. A resident of Washington, D.C., Mr. Ruby is a former adjunct professor at Georgetown University and is also a writer for Sports on Earth. His witty and insightful writing focuses on both sports and non-sports related topics, but has included the tragic concussion-related suicide of a high school football player. He contributes to The Atlantic Online, Washingtonian Magazine, Politico Magazine, and elsewhere. His work has also appeared in a handful of ESPN publications, such as ESPN.com and ESPN the Magazine, Reader's Digest, The Washington Times, Business Insider, and the UK Guardian Online. Additionally, 4 of his works have been selected for the Best American Sports Writing Anthology. Ladies and gentlemen, please welcome Mr. Patrick Ruby.
Thanks, everybody. I'd like to thank the school for having me. Like I said, my name is Patrick Ruby. I'm a journalist with the website Sports on Earth. You've already heard about our second panel. I had some remarks here prepared, but honestly, Chris did such a good job, I would be redundant in a lot of what I was going to say. So I'm just going to get down to it. I'm going to introduce our first speaker. This is Carrie Lowry. She's a senior staff attorney, and in fact, I believe you've been promoted since then. So you are a deputy director.
I am.
With the Public Health Law Network. She has extensive experience with health law and policy research. Her work has included the role of law in cancer and obesity prevention, tobacco use, child welfare, and emerging technologies. These are all areas that directly or indirectly relate to what we're talking about today. I think there's a lot of useful parallels there. She is going to discuss some of her research on state concussion laws, many of which are relatively new, as most of you know, and what kind of provisions are, and also importantly, are not working at the ground level. So Carrie, take it away.
There it is. Okay. Oh, okay, perfect. Hi, everyone. So I'm here to bring a sort of public health, population health perspective to our proceedings today, and to talk about the policy response to the concussion problem. Really quickly, because I'm talking public health, epidemiological data in TBI is probably grossly underestimated. I think Dr. Faden talked about this earlier this morning. The CDC estimates that between 1.6 and 3.8 million sports-related concussions happen in this country every year. Again, that's a really low number. For young people aged 15 to 24, TBI, sports-related TBI are the second leading cause of TBI after motor vehicle accidents. Once an athlete has suffered one concussion, they're 3 to 6 times more likely to suffer a second one. The risk is greater for young, developing brains for reasons that I'm sure physicians will explain to you later, because I only know enough to be dangerous. And girls have more symptoms and a longer recovery time than boys do. So before 2009, there was one state that had a law that even sort of talked about concussion management, and that was Texas. And that was sort of an education program for coaches. As of 2014, just March 1st, I believe Mississippi was the last state that signed a law in January of this year. All the states and the District of Columbia have some kind of concussion law related to return to play and trying to keep kids safer. If you look at this widespread and rapid adoption of legislation, it's really remarkable. So across the state laws, there are common provisions. The three key components of the Lightstep law, which was Washington State's law, which was really the first one that was passed with these three provisions. The first is education for student athletes and their parents or guardians with some kind of signed information form or acknowledgement of receipt, immediate removal of a concussed athlete, and some kind of return to play restrictions with medical evaluation attached. Again, these are the three key components of most pieces of legislation. These are the three components that the NFL really pushed when Roger Goodell sent his letter to all of the governors of the states that had not yet passed a law in 2011. This is what he encouraged them to pass. I would argue that these laws leave out some things that may potentially be very important, including mandatory training for coaches and officials and others that really have that on-the-field first look at a kid who's been hit, and also return to learn provisions and primary prevention provisions. So the laws have passed, now what? It's very tempting to kind of, brush off your hands and say, okay, from a public health perspective, we did it. But really, the next step here is evaluation, right? We want to make sure that the laws that have been passed are having the impact on outcomes that we really hoped they would have. It's still too early at this point. I think I showed you the laws just started getting passed in 2009, and the last one was just passed this year. It's too early to see impacts of these pieces of legislation on outcomes like chronic traumatic encephalopathy or early onset dementia or suicide risk, long-term effects. But we can start laying the groundwork for those studies now by making sure that we understand how the laws are being implemented across the states. If you look at the laws, if you read the laws, they're very similar. There's very little policy experimentation happening across the states. So they are very similar, but there might be very real differences in how they're being implemented on the ground that affect outcomes and that make a difference. So in order to try to get at this, I did a phone interview study of the key people in each state that were named in the statute as being charged with implementation. We sent out recruitment emails. We did exploratory phone interviews of state officials and leaders of organizations, including school athletic associations. We got IRB waivers both from University of Maryland and from Harvard School of Public Health. My co-author is from. We sent, again, recruitment emails to contacts in 43 states, because as of our study in 2012, that's how many states had passed laws, and DC. We had a response rate of 81%, which is actually very good. I was surprised that so many people wanted to talk to us. It was encouraging. So I just want to give you a sense of what they told us, what was helping them implement these laws, and what was really hindering them. In terms of promoting factors or things that helped with implementation, a clear delegation of authority or responsibility within the law was cited as very important. If people knew what their responsibility was and it was clear, obviously that helped with implementation. Pre-existing resources and partnerships, for example, partnerships with the local NFL team or with brain injury associations or universities, was also seen as really key. And prior state-level activity, we had a lot of respondents tell us that they've already been working actively in this area, and so it was easy for them to hit the ground running when the requirements of the legislation popped up. And you'll see, I'm not going to read these to you, but these are actual quotes from the respondents on the slides in green. As far as things that did not help, that inhibited implementation, many reports of vagueness in the statutory language. So, for example, an imprecise definition of youth. What does youth sports mean? Not clear which medical providers can authorize return to play. And I think, as we all know, that's sort of a controversial issue. Who should be authorized to make return to play decisions? And also a limited time to comply. Many of these pieces of legislation were emergency legislation or had immediate effective dates, which made it very difficult, especially when the bill was effective July 1st. And we all know football practice starts when? Like July or August, right? So that's not a lot of time to get into compliance. Also, the decentralized nature of recreational sports. So for the 16 states that actually have their laws applying to recreational sports, it was more difficult for them to implement the laws because there's not a centralized governing structure for recreational sports like there is for interscholastic athletics. Some reports of frustration with the legislation being an unfunded mandate, a lack of an attached fiscal note. And also, there were some implementers that were very frustrated about not being involved in the lawmaking process. Those that were involved in the lawmaking process actually cited fewer barriers to implementation. There were also some reports of a mismatch between the text of the law and what the infrastructure and the authority of the organizations charged with implementation actually do, which is a little bit unsettling. So, for example, there was a law that covered middle schools, but the High School Athletic Association was charged with implementation. And they were very frustrated because they're like, we don't have any control over the middle school, so they had to scramble to try to figure out how to make that happen. There was another state that had a requirement for return to play decisions to be made by medical providers that were, quote, qualified in the management of concussion, but there was no such qualification procedure in place in that state, and so providers were afraid to make return to play decisions because they didn't know if they would be deemed qualified. They have since removed that from their statutory language. I love these next two pictures, so pay attention to them. Imagine showing up to football practice and seeing this. Like, our coach, it's difficult. I show this only to show you an example of real problems with implementation that rural and also medically underserved areas are having. This is a picture of a football field in Barrow, Alaska. And I don't know if you know where Barrow, Alaska is, but it's right at the northern tip. They can probably see Russia from their houses. But anyway, just to pan up, this is that same football field. You can see that the blue rectangle there, panning up. So in Alaska's law, the return to play decision has to be made by a physician who is qualified in the recognition and management of concussion. And how many of those providers do you think are located in that area? Probably not very many. And football is one of the only things there is to do for these kids in this community. So some real touchy issues. This was the state that had the qualified language in their statute, and they were really struggling because probably the one physician in that community did not feel comfortable making the return to play decision. And so taking that language out of their statute really helped them. Some compliance challenges that were reported were doctor shopping by parents. As we went on and did the interviews, there were people that were saying it was becoming less of a problem, but it was cited as an issue. Other activities and inclusion of other activities. There was a recent Connecticut federal court ruling that cheerleading is not a sport under Title IX, which had nothing to do with concussions. The lawsuit had nothing to do with concussions, but the inadvertent effect of that was many cheerleading organizations saying, well, I don't have to comply with this law because, you know, we're not a sport, according to this court. Some fallout of this is, for example, New Jersey has just amended their state law to explicitly include cheerleading in their return to play provisions. Very few of the laws have enforcement provisions. Some criticize them as being toothless, but some of the kind of informal enforcement mechanisms that people cited are a general fear of liability for not complying, loss of eligibility of a coaching permit. So many of these states require the concussion training in order to get a coach's permit, and if you don't have the training, you can't have a permit. So that's a sort of enforcement. And also, there's unclear delegation of enforcement authority across the states. In Massachusetts, I'm not sure if you're familiar with their legislation. They have probably one of the most comprehensive pieces of legislation and accompanying regulations in the country, and they're still struggling with this issue. I'm sure you've all seen this story back in 2012 in Southbridge, their Pop Warner League. There were 5 kids that suffered concussions in a single game. Evaluation. So for reasons we talked about a few minutes ago, evaluation is going to be very important for us to know whether these laws are having the impact that we hoped that they would have. According to the people we talked to, 7 of 32 states reported that they were doing some form of data collection. Now, granted, this is reporting from the people we talked to, so they just might not have been aware that someone else in their state is actually collecting data. But of those who were collecting data, some were collecting incidence data, and we would expect to see an increase in incidence at this point because of heightened awareness of concussion symptoms, so an increase in diagnosis and therefore incidence. Some were tracking compliance, so schools reporting and trainings being completed. There's been some problem. This is a Boston Globe article from Massachusetts citing a problem with schools not reporting the data that they're required to report. It's one more thing that they have to do, which is another criticism. And also, some states are measuring hits to their website and other kinds of awareness measures. And again, states with partnerships, existing partnerships with their brain injury associations or their universities were more likely to be the states that were collecting data. So what is the future of concussion policies? Now that some of these laws have been on the books for five years or so, we've been marinating with them and trying to implement them. Doing the most recent update of these laws and looking at states that have amended their law since original passage, what we're starting to see is kind of a movement towards primary prevention. So these laws are really aimed at secondary prevention, right? Kind of preventing the exacerbation of an existing injury or the worsening of an existing injury. Some states are trying to add provisions that would prevent the concussion from happening in the first place. So we heard some of these already this morning, limits on dangerous play, leading with the helmet, using the helmet as a weapon. Massachusetts regulations actually forbid a coach or an official or a volunteer from allowing a child or a student athlete to use the helmet as a weapon. Limits on full contact practice time. I know Connecticut's a bill that's before their legislature right now limits full contact practice time to 90 minutes a week. Also adding officials or referees into the list of people that are required to take a training course. Right now, it's usually just coaches, if anyone, and there were a few states that have added referees. Adding data collection and reporting requirements, enforcement mechanisms, and broadening coverage to recreational sports and middle schools. Most state laws only cover high schools at this point. And also return to learn provisions. And I am out of time, so I'm not going to talk much about return to learn provisions, except to tell you that these are the 5 states that I'm aware of, and I've just was brought to my attention that New Jersey also has a return to learn provision where once a student has sustained a concussion, not only do they have to receive medical clearance to return to play, to return to athletic activity, but they have to not all of them require a medical clearance to return to academics, but some do, and some just require some kind of a plan to help the kid reacclimate back to academic learning because of the effects of a concussion on the ability to focus, and all the things that are required for schoolwork. So these slides will be made available to you so you can see them, but I'm going to stop talking so I don't make people mad at me. And here's a gratuitous picture of my kid. All right.
All right, thank you, Carrie. Our next speaker is Dion Kohler. She is an associate professor of law and the director of the Center for Sport and the Law at the University of Baltimore, right here in town. She's also a former faculty member here at the Francis King Carey School, so welcome back. And she's someone whose scholarship has included sports and health law, which obviously are appropriate to what we're talking about today. She's going to discuss the significance of legal responses to concussions in sports, tort laws, youth litigation. She's also going to talk about how historically sports regulators have been given wide deference by the legal system. Sometimes there's almost been an idea that there's really not a lot of place for the law within sports. As Dion will explain, that might be changing. Welcome.
I don't have anything left to do, Patrick. Thank you. Well, thank you. It's great to be back here at Maryland. Chris, I don't know where you went, but hearing you recall your concussion experiences in ice hockey made me think twice because my young son just took his first checking clinic last night, and the coach came up to me and said, "How do you feel about the fact that there will be coaches saying, go put number 10's head through the glass?" And I said, "Well, I'm giving a concussion presentation tomorrow. I'm gonna think about that a little longer." So anyway, thank you, Chris, for reminding me that the concussion issue is in fact very personal for all of us. Okay, so what I want to do today is I want to look at the legal response to concussions and sort of take the discussion in a different direction, in a new way. What I term the legal response to concussions includes state statutes and the litigation involving professional and intercollegiate sports. And what I want to do is explain how I see this legal response kind of fitting into the larger sports law landscape. And so I want to go beyond kind of the details of the statutes and the litigation and take a look at this from the perspective of, as Patrick said, government involvement in or state regulation of sports. And in doing so, I hope to make 2 main points. First of all, I think the legal response to concussions provides a good vehicle for us to consider the underlying values that really support our thinking about sports law and policy in the United States. And I also believe that the legal response to concussions in sports can provide an important theoretical pathway for more litigation in the future, particularly of youth or education-based sports programs. So by way of background, in the United States, we don't have a sort of completely consistent philosophy with respect to the law in sports, and particularly with youth sports. How much or how little courts, Congress, state legislatures should be involved. We haven't really completely thought that out. So if you think about it, on the one hand, probably the largest number of youth sports opportunities, and numbers on this are hard to get, but certainly a significant number of youth sports participation opportunities are embedded in our schools, right? So supported by public funding. On the other hand, we see through cases, the legal structure of sports, this view that the government should stay out of sports, that there's no role for the law to play in sports. And so, courts should step back and defer to institutions and to regulators. So what we see is that we have a lot of law that gets applied to sports in the United States, contract law, tort law, antitrust law, whatever, but relatively little law that's sort of aimed at sports. And I think it produces a situation with this sort of inconsistency. So if you think about it, we don't have a sports ministry. We're one of the only countries in the world, one of the few countries in the world, that doesn't have a government agency that regulates sports. Our Olympic movement, not just talking about sort of producing the elite athletes that go to the Olympics, but Olympic movement sports in the United States regulates everything all the way down to the grassroots level. So my poor son, who's going to get his head stuck in the glass at some hockey game, he's been a card-carrying member of USA Hockey since he was 6 years old. So our Olympic movement is enormous in the United States. It's quite deliberately, and I would say self-consciously, set up to be private in this country. So the United States Olympic Committee is a private corporation. The United States Anti-Doping Agency is a private corporation. And if you go back and look at the documents that set up this structure, what you see is this sort of Cold War mentality, this laissez-faire mentality that says the private sector and individual effort is best at producing great athletes. We're not like those crazy communist nations that invade other countries. Our athletes come in and they're produced from their own hard work and effort. And so we've wanted to sort of keep that going in this country. We also see that, again, although a substantial number of sports opportunities come through schools and public institutions, courts, legislatures, Congress gives great deference to schools to sort of establish and administer their programs with very, very little legal interference. And so cases involving school sports repeat over and over again, sports participation is a privilege, it's not a right, okay? So courts are seen as also not being in a great position to decide sports eligibility disputes. So if athletes bring a lawsuit saying that the school administrator said I'm not eligible to play for whatever reason, courts don't want to get involved in that and say, well, we're going to leave it up to voluntary associations, the NCAA, the High School Athletic Association, to decide whether you're eligible to play or not. Now, we know, of course, there are areas of exception where there is some law aimed at sport, and so kind of the main areas are statutes which I sort of say facilitate the growth of the professional sports industry. So you see like the Sports Broadcasting Act, which allow pooling of media rights, agent statutes, boxing and mixed martial arts statutes, stadium financing law. We also know kind of the most famous law that's applied to or aimed at sports is actually not in the statute at all, but the regulations, and that's Title IX, which requires prohibits discrimination in education-based sports programs. And there's a little bit of law in terms of regulating the health and safety of sports, again, looking at the boxing and MMA statutes, and if you see the Anabolic Steroids Control Act is sort of getting at banning steroids in sports. But really, none of these policy initiatives kind of regulate the content of sports programs. What sports are played or what sports aren't played? How are they managed? How are they coached? We really don't do that in this country. And so even Title IX, which is considered this sort of famous revolution in sports law and sports culture, doesn't actually regulate the content of programs themselves. Title IX gives explicit deference to institutions to say, do whatever you want with your sports programs as long as you meet the regulatory definition of equal athletic opportunity. So in addition, none of our exceptions to kind of the law getting involved in sports, none of these are really aimed at youth sports. So again, if you look at Title IX to the extent that it applies, of course, at the high school level, and if there are any middle school sports programs left in this country, again, it's not really aimed at sports, it's aimed at equality, it's aimed at non-discrimination in education programs, and comes with this built-in deference for the institutions themselves. So the question I was interested in is, okay, well, how does the legal response to concussions fit into this landscape? Are we sort of breaking new ground? And what I'm calling the legal response to concussions is a combination of the state statutes that Carrie talked about, proposed federal legislation, and the tort litigation involving the NFL, the NHL, the NCAA, and of course now we have litigation against helmet manufacturers as well. So as Carrie said, all of our states now have some kind of state statutes. I won't go into the details of those. They're built around those core principles of making everybody aware of the dangers of concussions, right? Parents and kids. Some might say that's building an assumption of the risk defense, 20 years ahead of time. They have removal provisions, so get kids out if they've been suspected of having a concussion, or we know they've had a concussion, and these return to play provisions. The Federal Contact Act, last I checked on billtracker.gov, had about a 6% chance of ever passing. Nevertheless, the NFL is very heavily behind it. This is the Concussion Treatment and Care Tools Act, which would direct the Department of Health and Human Services through the CDC to set up concussion management guidelines and provide grant funding for states to sort of aid in implementation, training coaches and the like, and collecting more data on actually the incidence of concussions and how many schools are adopting return to play guidelines. And finally, we have the concussion litigation. Everybody's heard about that through the news. The NFL concussion litigation, the settlement still being scrutinized. The NHL lawsuit recently filed in the district court down in DC, and the NCAA litigation, which is in the Northern District of Illinois and is sort of in a settlement, sort of mediation mode right now. So in terms of evaluating the legal response to concussions, I see it as there being two different narratives. I'll start with what is the sort of skeptical narrative, and that is that really the legal response to concussions is more the same old, same old. This is an example of the law sort of facilitating, promoting, helping out the professional sports industry in the United States. So, of course, the NFL has been heavily involved in lobbying for all these state statutes and getting it passed in the 50 states. Roger Goodell writing to governors saying, get this done, we really believe in protecting kids. Very heavily involved in lobbying for the Contact Act as well. And so the skeptical view would say, well, the NFL doesn't really care about kids. They just want to sort of improve the image of the game and keep the player pipeline going and maybe prevent any further regulation of the game of football or regulation that could apply to the game of football that would sort of dampen their player pipeline. And interestingly to me, although correlation is certainly not causation, for the last several years, we've had pretty marked drops in participation in youth football. Pop Warner statistics were really down. Since we've had this sort of sweeping 50-state statutes and all these movements to sort of make the game safer that the NFL has been behind, this year youth football participation statistics are right back up. So one might say, hey, the NFL getting involved and getting this getting these laws passed has been good for the game, right? In addition, the skeptical view is that, well, these statutes, this stuff is ineffective, right? Tort litigation, state statutes are ineffective at really doing anything. Public health researchers, and I think Carrie sort of mentioned some of this, have said, the statutes don't really get at what we need to get to, which is limiting the incidence of concussions to begin with. It can sort of prevent secondary effects, but really we're not doing anything except for creating a false sense of security. In addition, again, as Carrie mentioned, they don't come with any enforcement mechanism, that the statutes are really aspirational at best, and they have sort of no accountability. They have immunity provisions quite frequently for coaches and for healthcare professionals. And so with immunity and no accountability, right to sue provision, you don't have a law that adds up to much of anything. Similarly, the idea that tort litigation is effective at changing anything. People have said, well, tort litigation is notoriously inefficient at, of course, preventing future injury. And it's an inefficient way of even compensating those who are injured right now. And so all of this sort of adds up to an unwarranted intrusion in sports. That's the sort of skeptical view. I have an alternate view. I think the skeptical view has some important sort of significant criticisms to make. But I would say the alternate view is, I think for several reasons, the legal response to concussions is more significant than it might first appear. First of all, these are statutes that involve youth sports and not professional sports. And they involve, I think, an important break from the Cold War mentality, the laissez-faire attitude towards youth sports, which I think is significant. In addition, the statutes are sort of literally, if read literally, regulating the field of play. This is significant because the field of play and judgments in terms of who can play in the game, when and how, and who comes out, this is an area that has enjoyed some of the most significant deference from legal regulation. And if you look at case law involving the Rehabilitation Act and athletes who have brought suit against their schools, for instance, athletes with disabilities, saying you did not medically clear me to play, what you see is cases, again, giving great deference to the institutions to say, you make the call as to whether this individual can play or not. Now with these statutes, we see some of that deference being stripped, and I think that that's significant. In addition, I think it's significant that unlike boxing and MMA statutes would sort of stand out as being sport-specific, these statutes apply to any sport where you can get a concussion. They're not just sort of football-aimed, right? They're not just a carve-out for a particularly dangerous sport. They're going to apply across the board, soccer, lacrosse, even sports we don't think of as being particularly dangerous. In addition, I think the combined expressive powers of the statutes and the litigation can have a very important effect on helping us change the norms of sport. And I think we're having those conversations through these symposia and symposia like this across the country. But I think the norm shifting is happening in sports, and specifically we're talking about some of these values that we have always taken as a given with sports, right? The win at all costs model for sport, the play with pain model. And I think also the notion that there's no role for government, there's no role for law. I think we're taking on those values, we're having those discussions, and I think that that's significant even if youth concussion legislation has no enforcement mechanism. So the question is, what are the future implications? And this is what I've been thinking about and writing about. I think one future implication that is significant is we are going to, through this legal response to concussions, erode the calcified thinking around sports. I think in this country especially, we have this idea that sports are, there's sort of essential fundamental things about sports, right? It can only be constructed and played one way. You have to have football and you have to play it this way. So I was on a radio show recently. I had written an op-ed about youth football and medical research and about the dangers of concussions with little kids and advocating for changes to the game. And the host said to me, well, that doesn't make any sense. You can't limit tackling in football, then it's not football. And I said, well, the point is that sports are made up games. These are social constructs. We make them up ourselves, right? There's nothing essential about them. And of course, anybody who just watched the Winter Olympics and saw something called ski halfpipe or snowboard cross is reminded that these are made up games, right? 5 years ago, did snowboard cross even exist? So I think it's important, and again, I don't often align myself with Justice Scalia, but in his dissent in the PGA Tour versus Casey Martin case, he wrote a lot about this idea that we tend to think that there are things in sport that are fundamental, that are essential, that can't be changed. I think the legal response to concussions is sort of tapping us on the shoulder and saying, none of this is essential, and so let's rethink it so that kids can be safe. I also think it's very important, an important future implication for us is rethinking the role of the law or state action in sports. So if concussion statutes, if the litigation that's happening around concussions, if these are perceived as a good thing, sort of helping sports, make sports better, protecting individuals, compensating individuals, I think that can help us update our thinking on maybe there is a role to play. Maybe we don't need to sort of cling to these outmoded sort of Cold War ideas that, hey, sports is left to the private sector, sports is left to those who regulate it. And finally, I think one of the most significant implications of all of this, if you sort of look at the combination of regulating in the youth sports area and the normative changes which I think are resulting from the legal response to concussions, I think it can provide us with a pathway, kind of a theoretical pathway for future regulation. And I think the important area for this, and where we will see some thinking, at least I hope we will, is in education-based sports programs. So again, starting with where I began, or finishing with where I began, we have all these sports opportunities, kind of the most significant amount, embedded in our schools. We have a childhood obesity epidemic. We have a public health crisis that's actually bigger than concussions, if you look at childhood obesity and other things. We have a mountain of literature on problems with the model for sports in our schools. And I think the legal response to concussions can cause us to challenge some of our values about the way sports in schools are conducted, and hopefully cause us to have a better national dialogue on how we might make changes in that area and use the law to make challenges to education-based sports programs that can benefit all kids. Thank you.